We are here today on the Psychedelic Mom podcast with Dr. Johnathan Edwards, and I want to welcome you to the show. Thank you so much for being here today.
Thanks for having me. It's a great opportunity.
So you are an anesthesiologist, and one of your specialties right now, and it sounds like where your heart is being called, is to work with adolescents. So could you tell us a little bit? I know you've written several books, and can you tell us a little bit about your background and the books that you've written in this book that is coming out soon?
Sure. Yeah. I'm a anesthesiologist, almost 25 years. And yes, one of my heart's work or life's work, if you will, is of course anesthesia, mental health, and yes, helping adolescents and then that's all gone into helping people with mental illness of all sorts.
Mm-hmm.
And the books I've actually written a couple. The first books I wrote were on an African race called the Dakar Rally. Then I did one on the marathon. But more pertinently, the latest book that I wrote is called Suicide, COVID-19, and Ketamine. That book, the genesis of that book was from a very good friend of mine and collaborator in a sense, Gavin DeBecker.
Mm-hmm.
Gavin approached me one day and he says, what do you think about ketamine? And I told him everything. And he said, he said, well, if you write the book, I'll write the foreword. And, if you followed Gavin's work at all, he wrote The Gift of Fear, which is a riveting book about intuition, how it can save your life, really.
Mm-hmm.
And a lot of what this work is about using psychedelics and how it approaches suicide and other forms of mental illness tie into exactly that, your gut feeling, your intuition. So it came full circle. And so when he approached me about it, I was like, yeah, that's a no-brainer. I will write the book and I will get the information out there, and and it added to my practice already, of helping people with ketamine, mental illness, and even suicide. And it's been great.
Yeah, that's pretty amazing. So the ketamine piece and working with mental health and ketamine, have you been doing that for 20 years?
No, I've been doing that for about the last 4 to 5 years in conjunction with a psychiatrist, Zand, in the Calm Clinic at Las Vegas. That being said, I've been working as an anesthesiologist. We all work with ketamine. I've been working with ketamine and seeing what it can do for the last 25 years. So that's definitely my wheelhouse. And then, yeah.
So what was the switch for you to work with maybe ketamine as a pain reliever to then switching toward ketamine as a treatment for mental health in the past 4 years?
I've always had this interest, coming from Las Vegas. It always just struck me very hard that I had no less than 5 physician colleagues, all of whom had a child less than 18 years old commit suicide. And these were well-to-do kids. They had a want, in a sense, a want for what? They had cars, best schools, everything. And time after time, I would just hear about my colleagues, and I would hear their kids killed themselves in one sense or another. And this was way back in like early 2000s. And I just hear, and that's what really, I think, sparked my interest, like, to get into the mental health space.
Did you at that time think, wow, I think ketamine could be a solution for this?
No. I had to discover it on my own through other colleagues, but if you kind of look through, if I kind of think back in my practice and the people, I've given certain drugs to and all this kind of thing, you can see why it works. And an interesting story on that is Edward Domino. He was an anesthesiologist, I believe, back in the 70s. And nobody knew ketamine was an effective treatment for mental illness back then, but they did. And I write about this in my new book. There's a piece in there in one of his articles where the question is asked exactly what you just said. Why didn't we know this in the 70s when the drug came out? What he wrote was, he had a clinic where people were addicted to substances like ketamine and its derivative phencyclidine. And there's a quote in there. One of his patients, he asked straightforward, "Why are you addicted to this?" And he goes, "Oh, doctor, that's simple. It works way better than the antidepressants that I've been prescribed already, like 10 times better. That's why I keep taking it." And this was back in the 70s in published journals. So,
Wow.
and it wasn't until 2000 that it was really discovered or reinitiated that we knew this drug was the newest drug in 50 years to actually treat mental illness. So that's kind of the backstory.
So, just to begin, could you tell, for those in the audience that don't know what ketamine is, what is it? What has it historically been used for? And what is the chemistry of ketamine? What is it doing in the brain?
So ketamine is an anesthetic. It's a dissociative anesthetic in the sense it dissociates your mind from your body. So, when you take any type of these drugs, ketamine versus, say, propofol, which a lot of other people know, versus, others like midazolam and even fentanyl. All those drugs, in a sense, you go into your own headspace, and then you don't pay attention to your body in some shape or form. That's the chemical result of the drug entering your blood system and getting to the receptors in your brain. So that being said, in ketamine, I guess to put some other forethought into it, was introduced in the 1970s during the Vietnam War. So when it was introduced there, it became what's called a buddy drug. As we all know, catastrophes happened in the, in any war, especially the Vietnam War, but it was a drug that you could give another soldier on the spot, get them out of pain, basically dissociate them from their own injury. I mean, you could have a bone sticking out of your leg and you wouldn't care. That's how effective it is.
Wow, that's pretty unbelievable.
But it doesn't affect your breathing, and it maintains your blood pressure to some extent. So it became very popular amongst soldiers, therefore called a buddy drug in Vietnam. So fast forward to 2000, Yale researchers such as John Crystal and others, they, through hunches, basically, they discovered that a sub-anesthetic dose, not a dose used for anesthesia, much different, two different animals. And it's very important when I get to why these things work. So ketamine is able to modify the brain's thinking through several mechanisms. First one is just like antidepressants do. They help you get out of what's called that default mode network. I bet you've heard that term. So it's that rut that your brain just keeps going back to. It's stuck in it. No matter what you do, you can think and you can have a good experience, but boom, your thinking goes right back into that default mode network, which is the rut that keeps us in a chronic depression, for example. So it can change that. How does it change that? Well, it changes the neuroplasticity of the brain. The neuroplasticity of the brain is changed through increases in proteins. One of those is called brain-derived neurotrophic factor, or BDNF for short. Those are all increased. That drug's shown to be decreased in suicidal victims, for example. Another protein is mTOR, mechanistic target of rapamycin. That is also increased upon administration of substances like ketamine at the right dose, though. So if you give ketamine at a very high dose, like an anesthetic dose, not the same thing. Has to be, you have to be awake for the experience. You can't be asleep or you miss the benefits. So that's a little prelude of how ketamine can stop suicide or help somebody in a deep depression or an obsessive compulsive disorder, or even increase your creativity. Ketamine does all that.
Wow. That's fascinating. So now if someone went into the ER, for example, because they were suicidal, would the first stop be for that ER anesthesiologist to come in and administer ketamine?
You would think. So that's, given our great medical system, that's not exactly how it works. However, some of the thinkers at the forefront of this are Thomas Insel. He's the former head of the Mental National Institutes of Health. Basically, I mean, you could say he was, if you want to say he was the Fauci of mental health for the NIH. I interviewed him and got to know him a bit, and he says exactly this. One day, when a suicidal person comes into the emergency room, his hopes are that ketamine is the first line drug. Why? Because we can only institutionalize right now suicidal patients. And then when it comes to this topic of adolescents, it's even worse. You have to institutionalize them for legal reasons, for child protective reasons, for so they don't injure themselves. But if you had a drug like ketamine, there's a possibility you could render that adult or adolescent, for that matter, from a suicidal ideation state into not wanting to harm yourself or others. And you could actually treat that patient as an outpatient and not have to go through the trauma of institutionalization. So that's one of the things Dr. Insel is a big proponent of. And to that point, there are some doctors on this page. I know many ER physicians who know about this now. Some of it just through my book and the studies. They're all out there, but they'll give ketamine, to people, and they've come back. I have had several reports going, you wouldn't believe what happened to this patient after I gave them ketamine. Their depression lifted, or they just felt better about themselves, or they saw that their mom, that who died years earlier, and that gave them the bridge to get over the rut they were in.
Wow. Yeah. So, gosh, there's so many things here. I mean, there's so much to unpack, because we have the mental health crisis right now and accelerated since COVID. And then we have the adolescent mental health crisis, which seems to have escalated in the past 20 years to degrees that is really hard to comprehend. So even going back to what you were talking about earlier about colleagues calling you in your practice to say that their adolescents and teens had committed suicide.
Yeah.
In your practice today, how many, is it all teens? Is it mostly adolescents? Is it everybody that you're treating with ketamine?
Oh, I mean, mostly adults, to be honest. I mean, there are, it still hasn't made it into the mainstream for adolescents.
As far as adolescents go, because it's tricky treating an adolescent, and we're seeing not only suicidal ideation, but self-harm and multiple forms of ways in which kids are harming themselves. What is your experience in serving adolescents ketamine, and what is the science and research showing to date?
So there's not that many studies on adolescents and giving them ketamine. The biggest one so far is from Jennifer Dwyer. I went over this study on another podcast I did, where, I think they took, what was it, like 17 adolescents and randomized them to ketamine, or the control drug there is midazolam. And these are all profoundly depressed patients with scores, that put them into, we better do something with these kids. It's not just your run-of-the-mill depression, right? One single ketamine infusion reduced their symptoms 24 hours or more, days actually, in many cases. And they showed that it was well tolerated, and it had significant short-term effect, meaning 2 weeks or better, in reducing their depressive symptoms. And this has been repeated. Lori Calabrese, who I talk about a lot, she has a couple of adolescents in her practice that have gotten ketamine, and it helped their suicide. I'll get to my practice in a second, but I just want to preface, most of these cases also come from the cancer literature and the burn literature. Ketamine is a very common drug used in burn patients, for example. It's also used in cancer pain. So inevitably, some of these, adolescents are inflicted with cancer. And so therefore, some of these stories and case reports have come from that body of literature. In my practice, I've seen, I have given it to a couple kids. Actually, I'm treating a kid today. Mostly all teenagers. I'm not going to say I'm the one treating, 8 and 9-year-olds. But anyway, in my practice, it helps them get out of that depression. And like I had a kid, from the lockdowns, just doing really well before the lockdowns, had a kind of a history of depression, but it went really bad during the lockdowns. I mean, bad enough he had suicidal ideations, and and it was from that deep burden. Those are the necessary ingredients, if you will, for a suicide. Isolation, a burden, and no hope, hopelessness. You put those three together, and then you compound them with a lockdown. That's a recipe for a human wanting to leave the world.
So in your own practice, just since COVID, what would you say the increase in the levels of mental health coming to your practice has been?
That's an excellent question. I don't, at first I thought, the lockdowns are just going to, this plethora of suicides are going to happen, and they didn't actually. Whether that was a honeymoon period or, what we call, but there was an increase in mental illness for sure. The suicide rates didn't pan out as predicted, which is a good thing. But the increase in mental illness was unmistakable in kids. And again, most of my practice has been adults, and I wouldn't say any physician's practice in psychedelics anyway is mainly kids. That's not a thing right now. There's just people like me who know a lot about it, right? But
Mhm.
but like I said, there's many people like myself, Calabrese, and others who have dealt with kids, and at the
Mhm.
same time, one case I was involved in, the child, very young, actually got 6 treatments of ketamine. Didn't do anything for the child. Why?
Yeah.
Because they assumed the child was suicidal. That wasn't the case. Um, the the kid was just actually deeply depressed and had trauma about the mom, and it just wasn't.
And so
Yeah. So
take that for example. I know that, mushrooms
yeah,
and other psychedelics can help with healing deep trauma. Is
100%.
ketamine a medicine that you would use for deep trauma or no?
Yes. Yes. And
Yes.
yes. Go
So
ahead.
with that particular client, although he didn't have suicidal ideation and he had maybe deep trauma and some relational trauma with his mother, did that get worked through with ketamine?
That's a good question. I don't believe so. And the
Hmm.
reason is because they didn't have the right therapy along with it.
Yeah.
There's no way giving just the psychedelic without the proper structure, because when you're in these mental places, you're in the desert. You don't have a sustainable meaning to your life, and you don't have the structure around you. And a psychedelic like ketamine or psilocybin or whatever you want to say is just one component of that sustainable structure that's going to save you in the desert. It's just,
Hmm.
and a lot of people come to me, and I've had it time and time again. I just want to do the ketamine because I just want to take the ketamine at home, or I want to do the infusion and be better. And I tell them all up front, this is not the right place for you. Then, if you're not going to work
Hmm.
with a therapist, this is likely not going to do anything for you. And I can't tell you how many times I've had that situation approach me, and I'm the first one to. That's why I work with a psychiatrist.
Yeah, I think it's vital. Um, and even I have a friend who did a series of ketamine treatments at a pretty well-known, well-respected place with incredible facilitators
Hmm.
as well as um, psychedelic integration specialists. And it was still interesting. I still think that the level of integration and support after was probably insufficient.
Yeah.
And so, how long would well, you're just administering the medicine, right? So you're not doing the integration
Yeah,
process.
I mean, yeah, exactly. I mean, I'm part of the integration in a sense. I mean, just, you know,
Hmm.
I've been told that, like, people feel way more comfortable with me doing it and this kind of thing. So in a sense, I don't know if it's just the way I present it to them, you know.
So you're kind of creating that safe container
Yeah,
so
I
that
would
the
say,
work can
yeah,
happen.
yep. But
And then you have a psychiatrist who's
100%.
doing a lot of the integration work. Um,
Yep.
yeah. So, what about those cases? Like, I was just reading recently about a series of ketamine clinics that just closed. Um, is there movement in this space so quickly to expand? Like, do we know enough about how ketamine long term affects people's mental health? Do we have that data yet?
No, I mean, we're only in it like what, 20, 30 years, 20 years.
Yeah.
Um, yeah, so I would agree. Probably what you're thinking. I wouldn't say that's the case. I mean, we the thing we do know, it can stop suicide. I do tell
Okay.
people, if you're dealing with suicide or a loved one with suicide, it's behoove you to at least try it.
Yeah.
It's safe, and the downsides are minimal, but the upsides are fabulous if it works. But it's not a big deal if it doesn't, in a sense.
And what about someone with depression, eating disorders, those kinds of things? What is your thought about ketamine's effectiveness as a psychedelic for treating those
Again, there's big studies on that, right? Even going on right now. Lori, on the food disorder spectrum. Again,
Mhm.
Lori Calabrese has done combining the ketogenic diet along with ketamine treatments. And she's finding a big improvement. And, there's a lot of evidence for the ketogenic diet. And let me preface that a well designed ketogenic diet, you can do it totally
Mm-hmm.
wrong.
Mm-hmm.
But if you do it right, with non-processed foods and you really, that kind of thing. Chris Palmer, he just wrote a book called Brain Health, and I followed him for a long time. He shows very clearly that many mental illnesses can be helped just with this kind of diet alone, in a sense. But Calabrese has
Right.
taken it even farther and done a pretty sizable study, just like she did with the outpatient suicide treatment paper she did, which was fantastic. So I think she's done a really good job. So
Wow. So, what's your personal story? Have you experienced psychedelics? Have you gone down the path of using any earth medicines or psychedelics for your own healing or your own
yep,
deep level of consciousness and
sure,
awakening?
yeah. Yeah, I've done it in a clinic. The ketamine once. And yeah, in the book I kind of expand. I had, oh my gosh, I grew up traumas like, yeah, I was probably like a lot of people, but I had alcoholic father, I saw violence, mom, fights, um,
Mm-hmm.
really bad ones, so, and then, that all got better, with time. And then,
Mm-hmm.
my mom died on 9/11. That was the great, that same day of a heart arrhythmia, along with a lot of people died like that, actually. But anyway, lost. So
Wow.
for that day has a whole different meaning for me, um, in a sense. And yeah, so we all have our traumas, and to that I'll say, you know psychedelics have a profound effect on those kind of issues, and I've often thought to myself, like, I see why, say, the Indians, for example, or, like native tribes, you know, they do these things ritualistically, and there's evidence
Mm-hmm.
of these psychedelics going back 6,000 years ago. And it's becoming pretty apparent, I think why, and, especially as I've read more of, like, Gabor Mate's, work. It's pretty,
Mm-hmm.
he spells all that out pretty well.
Yeah.
Yeah, so I've come to understand it in a way not taught in medical school, for sure. And
Yeah. So, would you mind talking about your own personal process a little bit more of like how specifically you would say a psychedelic helped you heal from those traumas?
I would, yeah, I would say a psychedelic experience just shows you're a speck of energy in the whole thing, and the things you're making a big deal about, in a sense, don't matter. You know,
Mm.
um, to a point, everything matters, but the way you're making them matter, at least the way I was making things matter, uh,
Hmm.
wasn't relevant to the whole process. And when I was under the experience, I saw my mom, my grandparents. Just time didn't have any relevance at all. And yeah, so for that was healing.
Yeah.
And I would say that opened me up to why this really works, and why people should do it or not do it. And it gave me respect for the others, like psilocybin, MDMA. The power of those things, and it's you know and the and kind of the unfortunate circumstances in I think the 1960s and 70s, where the federal government put the stop on the psychedelic research, and it's just coming back now. And I think
Yeah.
we missed a big boat with all that, and I've written a lot about, like, Timothy Leary, and how he said, whatever, tune out, or drop, what did he say? T-
Tune tune
tu-
in, drop out.
yeah, said drop, or
I forget.
take psychedelics, tune in, drop
Yeah.
out. And Jordan Peterson's is like, take psychedelics, tune in, grow up.
Yeah.
And that. I think that's the boat we've missed for a long time. So
Yeah, I would almost say, gosh, in my own experience, in my work with people with psychedelics, it would be go in, which is tune
yeah,
in, and know what's true. Know the truth of who you are.
right,
Um,
yep,
yeah. So one thing that I've been thinking about recently, and I'm curious about in your field, in particular, you're working with ketamine, which is not an earth medicine. And you just mentioned kind of native tribes and how these medicines were part of initiations,
right,
part of the life.
yeah,
I've really been wondering about the westernization of psychedelics and earth medicines, and maybe the over pharmacologicalizing of these medicines.
mm,
And I see like both sides. I see like as Westerners, we want the research and we're research driven and we have this clinical model. I'm curious in your utopian idea of how ketamine might be administered and served for someone who is suffering with treatment resistant depression, who might be a teen. What might that look like in an ideal world?
well, one, insurance would pay for it, so you'd get help financially just doing these things, because
Mm-hmm.
going to a ketamine clinic is not cheap. um,
Yeah.
it's just the nature of it. So the recognition that these things, could be, funded, in certain ways, I think would be one part of it. Number two is just, I don't, definitely you don't need to go to something like ketamine right away, right? Or any psychedelic. Um, I mean, therapy and just having a good family structure around you can often solve a lot of these problems, but
Mm-hmm.
for when it gets to, the point where it just, what the adolescent seems like there's no other way except for, to radically change themselves or be depressed or even suicide. um, you know the, the emergency rooms are usually the first place that accepts these people. So in an ideal world, you would get ketamine right there and then, when you have that suicidal ideation, and you come in, and then you would be plugged in with not just a therapist, but a therapist who gets it, somebody who understands the power of the readiness the psychedelic puts your brain into, ready to be remolded in a sense, right? So you're out of
Mm-hmm.
you got less of the default mode network going on. You got the brain chemistry that's all optimized to now receive some of that therapy and actually change the neural pathways from which you were stuck in.
Mm-hmm.
And so that's, I think that's how I would see it go in I guess in an ideal system.
Yeah, I guess in some ways, in an ideal system, our kids aren't depressed, right? Our kids aren't suffering to the degree that they
Oh,
are.
yeah, I get it. Yeah, I would say to
I mean,
that,
some of it,
depression is
yeah. I
normal.
mean,
Happiness is not 100%. Otherwise, we wouldn't be human. And it's normal to to suffer. To be, again, it goes back to sustainable structure. What it's having those tools around you when you are depressed that comes that takes you out of it, or those kind of things. And
yeah.
that's what's, a lot of that is missing right now. Yeah.
Yeah, that's kind of what I meant. Like,
Yeah.
of course, depression is natural.
Yeah.
It seems like to some degree the systems that are holding the Western culture together at the moment for youth, I don't think we would see such mental illness if maybe there were that the systems were a little bit different for them.
Mm.
For example, like what have you? Well, let's say, do you have kids?
Yes, I do. I have an 11-year-old
You do.
daughter. Yep.
Okay. Oh my gosh. Okay. So would you feel comfortable giving your 11-year-old daughter ketamine if she ended up in a place where she was struggling with her mental health, with depression, anxiety, or feeding disorder? Is that something you would feel comfortable giving your daughter?
100%.
Yeah.
Or psilocybin, or something. I don't have to necessarily give them a shot or something. I might, any of that I would be open to.
Yeah.
In that realm, right? So.
Mm-hmm. So can you tell me a little bit about your book? That's COVID. So you're really tying together what happened during
Yeah, the
COVID, the mental health
lockdowns and all
of
that.
adolescents, the lockdowns. Could you speak about that and where you feel like what kind of damage that did and how youth are struggling right now?
Ugh. So if you read Johnathan Haidt and Rebecca Twenge, you'll
Mm-hmm.
realize very quickly that adolescents have been suffering with mental illness since early 2000s, with the
Mm-hmm.
advent of apps, the phones, all that kind of things. I mean, it's clear. Um, it it not began there, but there's a definite start, right? Concrete start right there. Then you come back, and you're just going through the troubles of childhood, whatever, and then we come to the lockdowns. Lockdowns just amplified that by however many times. Um, and it fed the ingredients: isolation. I'm now a burden. This isn't going to
Mm-hmm.
stop. This seems hopeless. And that was the reality for many kids. And one proof of that is what I wrote about in Las Vegas. You had 18 children, not problems of the state, not with severe, history, mental problems that, where you usually see these suicides coming from, but 18 school kids in a Clark County school district commit suicide, mostly through researching on their school issued iPads. That happened all during the
Were
lockdowns.
they were they friends? Was this a pact? Was this
Nope.
8 separate
No, nope.
individuals?
These were all isolated
Wow.
events. And of course, I don't have the details on them all.
Right.
But the thing I do have the details is their deaths. The governor back then, Sisolak, he would go on his State of the Union address or State of the State addresses, and he would start off with, "Another child committed suicide yesterday." I mean, that went on for 18 deaths. And then a big New York Times article on that with Jesus Shara, who's superintendent of that Clark County School District. He, all that's referenced there, and he talks a lot about it. And it was a lot. The kids were just not in school. Not being in school became a very dangerous thing, and not for everybody, but for those 18 kids, I argue that, like, if we knew the signs better, which, by the way,
Mm-hmm.
are astronomically difficult to see in a kid if you're not looking for it.
Mm-hmm.
What if these kids could have got some kind of help, and even a psychedelic, ketamine or whatever, would have that changed the course of their
Yeah, when I was thinking
lives,
of Yeah, I had a daughter who struggled in high school. Um, and so when I was thinking about you, and I heard your interview actually about using
Mhm.
ketamine for adolescents, and it's kind of what made me reach out to you because I have been thinking like, what would have been different if, I mean, my daughter is fine now, but during the time of like a deep depression, what would have been different if ketamine was an option? And this was going back years before I was even in the psychedelic space. So I didn't have even the knowledge and wisdom about the profundity of these medicines. I do wonder. And now that you have an 11-year-old and you're in this space, I'm curious, how do you protect your daughter? What are some things that you, just from the knowledge that you have, being in a space with somebody, whether that's a teen or a young adult, what do you look for, or how do you feel like you as a dad, this impacts you?
Wow. You're gonna like this answer. So I reckon, obviously it goes back, when I was kind of, first recognizing this as, my physician colleagues, their kids committing suicide. So one, I took her out of Las Vegas as a young child. But number two, I said she needs to grow up with a little bit of adversity. We have a home in France. I'm a French speaker. I said she'd already had a couple of years of maternal French school off and on. But I said to my wife, we're moving to France and she's going to do her first grade in France. She didn't really, she knew the language, but not that well. And I'll never forget seeing her struggle with the adversity. You make certain friends, you don't have certain friends. And I remember just my heart sinking one time watching her play on the playground. She'd try to go play with somebody and they just kind of I don't know what happened, but then she'd run back to her corner and I go, oh, but she was learning to deal with adversity. And just, not everybody can do this, but that was to your question, that was one of my solutions to protecting my daughter. And I believe that different environment and learning and how to deal with adversity. And it's true. We came back to the States. She's now in 5th grade and she handles adversity better than many kids that I've seen anyway, So that's kind of my answer to that. Changing environments, getting them used to different environments, I think is a big part of building that structure, around them, that when they're in the desert, I always like to go back to this, when you're in the desert and you can't see anybody around you, it basically becomes those tools you form during life that's going to get you out of it.
So you moved to France and then you came back. You originally decided to move out of Las Vegas into this area. So where do you live now?
We reside in Florida. Yeah, on the East Coast.
Okay.
Yep, East Coast of Florida.
Yep.
Yeah.
Yeah. Wow. So let's go back to the book that you wrote and
that's right.
COVID and lockdowns. Yes. And I know I got a little sidetracked. Right, I wanted to hear about your daughter and what you're seeing from all that research that you did. What is kind of like some of the 5 points in your book that are really profound, speaking to these lockdowns and the mental health issue today?
Well, when I wrote about it, it was kind of controversial to write about that stuff because, everybody thought, oh, there's no harm to the lockdowns. We're saving people, and whatever you think about that. One point that's true about that right now is that the lockdowns did way more damage than we thought they were going to do in every country.
Yeah. And it was hard because nobody could really talk about it because you were canceled if you did.
Right.
So there was a silencing of free speech, and that's hard for the medical profession who's actually seeing the data.
Well, yeah, and you can't treat people the way you need to, and without free speech, you can't do good medicine, and without free speech, you can't, you're just oppressed, and everybody's poor.
Yeah. So you were seeing that the lockdowns were having a great negative impact on youth.
Yeah, well, I mean, the studies were obvious, and the case reports were
Hmm.
obvious. Um, it showed what one report showed, I mean, just from the CDC, actually, that kids 15 to 24, a quarter of them had thought about killing themselves. I mean, and then you go to isolated events, like the Hayden Huxtable story out of Texas. He has his dad posted a website after his suicide. That's riveting. There was the case of Lorna Breen. This is in the New York Times. She was an ER physician. Uh, she took her own life during the lockdowns, for various reasons. That's all detailed in my book. There's a story of a Major League Baseball player named Drew Robinson, who I've come to know, and he's a spokesperson now, but he survived his suicide attempt during the lockdowns. I mean, not
Hmm.
many people can say that, but
Right.
so, but if you go through the isolated stories of all these people it affected and all these kids, you know, I mean, that's once I started writing about it, I said, I have to get this out. I have to do this. That, these kids' stories can't be suppressed. We have to learn from this. And that was,
Hmm.
and, and I got a huge compliment. I was at this event called the Broken Science Initiative, put on by the former owner of CrossFit named Greg Glassman, and
Hmm.
it was a pretty big event. You had to be invited, all this kind of thing, and they're just talking about kind of how the science is broken, and there's several reasons for that, and it does kind of go back to free speech in a way, right? But Jay, I don't know if you ever followed the great. It was called the Great Barrington Declaration, and they basically pointed out that lockdowns were going to do more damage than we ever thought, and they were suppressed and canceled from the get-go. And one of the authors of that was Jay Bhattacharya, and he was just on Jordan Peterson, for example. He was just he testified at the Senate just recently, and I'll never forget. He came up to me, and I just introduced myself it's being friendly. And he goes, "Oh, you're Johnathan Edwards," and I'm not used to this. I'm not a public figure. I don't care. And he goes, "Thanks for your book. You were the only one who wrote about the suicide, the suicides happening during the lockdowns." Um, and I just thought, wow, for me, it was about even when we could save one life, it's worth it, But
So, what were the numbers? What were the numbers during COVID? If you took the years of the lockdowns, what were the numbers of increase in suicide during that time period?
not okay. So that's where I go back to the beginning. There was only every suicide matters, right? But there was
Yes.
a couple thousand more suicides than normal.
Hmm.
You know, and granted, we've had years where the suicide rates in the early 2000s, like 2003, were way higher than we ever had them now. So there's different things that cause it. Um, so it's
So
not
you weren't in your book just talking maybe in your book you're not just talking about suicide, you're talking about mental health in
hundred
general due
percent.
to the
Yep. Yeah.
lockdowns.
I
Yeah.
would say you didn't see that many more suicides, but you saw, you have to preface that with the overdoses. We saw
Oh yeah.
tens of thousands of more overdoses. And the thing most people don't get about overdoses, unless there's a note attached to your body when you overdose, it's considered an overdose, not a suicide. So even the Jonathan Singer, the president of the American Association of Psychiatric Physicians, he stated that in his one of his opening remarks. He goes, "We have no idea what the real rate of suicide
Hmm.
is." And
Hmm.
it's debated. This is all debated. But I mean, just look at But when you look at the case reports of, it's just not normal for 18 kids to kill themselves in a normal school district. And this not just happened in Las Vegas. You can look in Arizona. It happened there. Anaheim, California. It happened there. It happened in Baltimore. I mean, you just and all that's a lot of that's in the book. Not all of it. A lot of it is, and if you start digging and researching, you will find it. It's there.
So let me just ask you, as somebody who was doing this research, starting to write this book, speaking out against it during a time when you would be canceled.
Mm-hmm.
Not only that, you'd be considered crazy.
I quit my job and everything. I stopped working for the corporations, and so I kind of went on my own. So I was able to do this.
Yeah. What did that feel like, to feel like you were doing your research the best that you can, and maybe being just looked at as someone who was, or were you looked at as someone who had like conspiracy theory ideas?
I have no idea.
No.
I don't know how anybody looked at me, because I never paid attention to that. I just was into the book and I was writing it. I had some great editors. I had some great help. So to be honest, Michaela, I don't know what anybody was thinking.
Yeah. So your practice now is in Florida, and what are you seeing like now that COVID is over? Are you seeing a decrease, or do you feel like the effects of COVID are still?
The effects of the lockdowns are still there. I would have to say, in my experience, I don't, the whole depression thing and chronic depression and just kids feeling hopelessness is still there. And I think it obviously probably depends on the state you're in for various reasons. But overall, I don't think we've gotten the effects are going to be here for years to come.
Wow. So I want to switch gears a little bit on ketamine. Can ketamine help with addiction? And also, conversely, is ketamine addictive?
Yes and yes.
Okay. Let's dive down this a little bit.
Yeah. So to the first question is, can ketamine help with addiction? Oh my gosh. So Dr. Wolfson wrote a whole book on this. He does what's called ketamine-assisted psychotherapy. So basically, some of these studies were first shown by Krupski in Russia. Celia Morgan has repeated a lot of these studies in the UK. And they show that ketamine-assisted therapy really helps in severe alcoholism, for example. And I mean, they go as far as like putting you under ketamine and giving you the scent of alcohol at the same time, and then right after you'd get therapy. I suppose the things to keep in mind about these studies, though, is they may not be real world. By that I mean, for example, in the Morgan series where she did, she's in the UK a researcher, psychologist. The level of therapy they were getting was very high end. Not everybody has access to this type of therapy and this dedication of therapy, but it just goes to the show that like the therapy you get matters. So ketamine can stop alcoholism. Ketamine's been used in cocaine addiction. It's been used in heroin addiction, and it's even been used in ketamine addiction. So believe it or not.
Wow.
Right?
Wow.
Yeah. I mean, it's, in some cases, but the first three I said are the main use, the main use of, say, ketamine in addiction.
And basically, it's probably, again, it's that default network being having the capacity to grow neurons around a perseverative behavior.
Yeah.
So let's talk about the addictive qualities of ketamine.
So traditionally, ketamine is an addictive substance for sure, but not in the way, say, heroin is or cocaine is. The first difference is ketamine doesn't have the rebound effects or the withdrawal effects you see with a drug like heroin or a drug like cocaine. You come off those drugs and your sympathetic nervous system does things to you that almost kill you. You could take almost as much ketamine as you want. Of course, there's a lethal dose. There's a lethal dose with water, right? But you can take a lot of ketamine and you won't get, say, withdrawal effects. So that's kind of the difference with that. But
does that actually even make it more addictive because it might be a drug that someone would go to?
No, I mean, Dave Feifel, he's the Kadima clinic there in San Diego. He's done a lot on this, and he's done over 6,000 patients with ketamine, and he's shown a very low rate of ketamine addiction, very low. Like so there's two sides to it, right? There's a street ketamine and there's a pharmacologic ketamine. I use the pharmacologic ketamine only.
And you are doing it intramuscularly,
both,
intravenously?
Intramuscularly, intranasally, and orally. You can do all four routes. Okay. Street ketamine, however, is a different animal. And this is where you see some of the severe side effects that can come with ketamine, like bladder cystitis and damage and all that kind of thing. But people, I don't know what it is, and especially in Asia, they have a huge problem with this in Asian countries with ketamine addiction, but it's all with powders, right? That you snort or take orally or this kind of thing. And that seems to be much more of the addiction that you see of ketamine nowadays. And I have friends who are, DEA agents, and they tell me about it, and yeah, there's a big profit margin in it. People bringing in kilos of ketamine. And yeah, they're just but the real danger right now of ketamine that should be highlighted is that, just like with everything else, they're lacing the ketamine with the fentanyl. This is a travesty. I mean, this is, the China makes it and it's the drug cartels that are all too happy to distribute it and make it and put it all together and sell it in one kind of package. And so the fentanyl being laced with ketamine right now, street ketamine, is a big problem, huge problem.
Wow.
And it's killing people. To go on the fentanyl thing, I would say more people are dying from fentanyl overdose than suicide all day long.
Wow.
Yeah, so just to finish on the ketamine addiction thing, yes, you can be addicted to pharmacological ketamine as well. I mean, all you have to do is read about, guys like, I don't think Leary, but there's I'm dropping his name. He's John Lilly. John Lilly was a famous physician who was chronically addicted to ketamine. And he wrote some great books. I mean, he's a fabulous thinker. He was. But he was, for the most of his adult life, he was addicted to ketamine. So just like anything that starts out magical, right? That's how addictions start. It's kind of crazy. I've learned more about psychiatry ever than most psychiatrists have, just through my studies.
Right.
So
wow.
And anyway, so just like anything starts off benign and magical, it can lead to all the bad choices that people make with any addiction, whether the most being alcohol, of course, but anything.
It's fascinating that ketamine can heal addiction, and what you're just speaking to is that street ketamine, not only is it lined a lot of times with fentanyl, but can cause kidney damage as well as addiction itself.
Yes.
And can be really dangerous. So one of the areas that I also want to touch on, because I interviewed someone recently who works with veterans, and he was telling me about the suicide rates within the veteran community and first responder rates. Where else are the rates of suicide in our country right now high? And is ketamine being used to support those populations?
So yes, to the veteran question, it's been recent. We used to think it was like 20 veterans a day who committed suicide, and now the real number's turning out to be possibly 40 and above. And that's
It's so tragic,
think.
just
I mean,
tragic.
it's hard to think, but or imagine that many people would, take their last act as that every single day. Um,
Well, especially too because they've been in all in the name of service, right?
right.
They
Yeah.
were serving our country, and then they kind of get left behind, and that shows you the level of trauma
Yeah.
and what unprocessed trauma does to a human being.
Yeah. So treating ketamine with PTSD has had good effects, good results, but some of the effects haven't been what they are, say, from stopping suicide in somebody who's not suffering from, say, soldier PTSD. Um, I, I think a good way to phrase that is like when soldiers get on PTSD, or get in a psychedelic experience, often they come to images of like, their gun melting, or they're in the space and they're in the experience, and the people they saw die around them come up to them in a white robe, just putting their hand on their shoulder, going, "Hey, it's okay. Go on with your life."
Mm-hmm.
And these are the
Mm-hmm.
things that help soldiers with PTSD get better. And I've detailed many stories in both of my books, um, that are out about PTSD soldier and what psychedelics can do for them. The latest good news, though, is that Johns Hopkins University is doing a huge study that's in phase 3 trials right now with MDMA, showing a very good result. And these kind of things are going to lead to soldiers with PTSD anyway having first line treatment if they need it with psychedelics. And that is wonderful news. So hopefully this keeps going. But that's, on the veteran front, it's serious. And
It's very serious.
yeah,
Yeah.
there's so.
And I don't know if you know Ben Moore. That's who I just interviewed. He started the psilomethoxin church, which uses a mushroom that has been grown with 5-MeO-DMT in it. So it has
Ooh.
the psilocybin and the 5-MeO-DMT.
Mm.
And he's a veteran himself, and he's supporting veterans. So I just want to understand what you were saying, though. To date, are you saying that ketamine hasn't been able to support veterans as much? Is that due to the type of the medicine itself, or is that due to it hasn't been used enough?
At both. I think it hasn't been
Mm-hmm.
used enough with the right kind of therapy. John Crystal just did a study on it, and he found that the ketamine took away the depression with soldiers in PTSD,
Mm.
but not necessarily the PTSD in the way you thought it would be taken care of. And
Interesting.
where
Yeah.
MDMA
Well,
has shown kind of more, it takes care of the PTSD.
so I have a question about that because in my own research that I've done and some of my own work with clients, one of the things that it seems is that when a mystical experience is
Mm-hmm.
induced, and I think this even comes out of some of the Johns Hopkins studies, whether that's addiction or trauma, it's that experience of something mystical, something beyond oneself that can do the deep healing of this work. Now, some of it is the chemical rewiring and the neurology, but some of it is what you had talked about earlier, even in your own experience of feeling yourself, that there was something more, that
Yeah.
the thoughts that you were having, there was something more. So I've only experienced ketamine once, and it was not necessarily a medicine that I was drawn to. I work with other medicines with clients and in my own process. And I think it was, again, some black and white thinking like, oh, it's not an earth medicine, it's a chemical. But I had a lot of clients asking for it and really curious about whether it was something I would want to get trained in. So I did experience it. And I was actually really shocked
Yeah.
because it was, and again, I don't know. I don't know how these medicines work. I don't know if you clear certain things. The experiences are different. So ketamine came late in my journey. It was something that, just even in the last 6 months that I did ketamine, but my experience was so mystical.
Yeah.
It was one of the most beautifully mystical experiences that I've had. And I wasn't expecting that from ketamine.
You're not
Is
the first
that
person I've heard
typical?
this from.
Okay. Yeah. Yeah.
Yeah, I've heard it. I, I I've given ketamine to people who've done a lot of psilocybin, and they say, one, it's different, but two, it was just 10 times what psilocybin did to them. I don't know.
Interesting.
I've never had psilocybin, so I don't know. But this, I've had many clients who told me this.
Mm-hmm. So again, just being in this space and being a father, doing all this research on suicide, lockdowns, just in your unique position in life. And do you have any advice for a listener who either might be depressed themselves, might have suicidal ideation, or is a parent that has a child that's struggling?
Sure. Yeah. So if you have an adolescent who's struggling, um, I really think you have to take some big steps and really look into with yourself and be willing to change this child's environment. And you can do that in many ways. You can change their environment physically, which is often one of the most effective things you can do. I mean, if, you know, I would do that in a heartbeat, with my child, and I'm prepared to do so. Not everybody's so blessed, for sure.
Mm-hmm.
I would be willing. I would get therapy a lot sooner than later. I wouldn't be resistant to the idea. And we've done kind of some of this. I think like say Landmark, for example, if you've ever heard of Landmark forums for kids.
Mm-hmm.
I mean, you talk about some great preparation for, how to handle adversity and not blame yourself.
So for someone that doesn't know what Landmark is, could you just give a little background of what Landmark is and why a parent might be interested in it for their child?
Sure. So Landmark is a forum. Landmark is not psychotherapy. It's more life therapy. So it's an organization kind of like Tony Robbins.
Mm-hmm.
I know Tony Robbins personally, and I've gone to his seminars. I've been, again, lucky enough to do that. But Landmark in the same way, it just kind of shows you that, all these things you're putting in your head and how you're dealing with them as an individual is harmful only to yourself and then to those others you're attached to. And they just show you neat, creative ways and really just change in language, change in thought
Mm-hmm.
patterns, of how to approach life in a different way. And then it goes back to like telling the truth. It's like you see the importance of telling the truth, because I go a lot on what Peterson says to these kind of things, but he's not the only one. You get this in Landmark, you get this in Tony Robbins, you get this in other places, that when you say the truth of your life, you open up that human adventure. And if you don't have that human adventure, you can't move forward. You can't achieve what you've always wanted to. And until you take out some of those barriers, such as depression, hopelessness, change in environment, you can't be truthful with yourself. And anyway, I don't want to get on a soapbox here, but things like Landmark and the others, that's, I would say, they're what they can help with.
Mm-hmm.
And for me, I didn't really discover all that until I was able, partly because of my wife, she got me into it. I got to
Mm-hmm.
have to give her credit there, because I was resistant at first. And then also to, some of the other contacts I've had. But, in that question, how would I pack this all into that statement? It's just going after the big truth of your life, but you can't do it until you come to certain realizations and see things in different ways. And that's what I would say about it.
Yeah. And in some ways, I think also what you're talking about is as parents doing the own work ourselves,
Yeah.
because being the example of, it's not what happens to us in life, but it's how we respond, and having the mental capacities and pattern practices around when we have difficult times, how to flip our thinking, how to change our mind, and if we can train that to our kids. But I like that idea of not being resistant,
Yeah.
because if we're seeing these numbers as they are in the mental health industry, it's not a time for resistance. It's a time to lean into the supports that are out there, then wisdom that we do have, and to continue to push the edges. And, I thank you for being out there and being really on the edges of this work, because I actually got into the psychedelic field after my daughter had that depression, because I thought there's got to be a better way. There has to be more supports for kids. Now, we haven't gotten necessarily to that point yet in our Western culture of serving adolescents and teens medicine yet. And I think it is a delicate topic. So I want to thank you for kind of being on the
Yeah.
forefront, at least in the ketamine space. It's a brave world. I actually have an interview coming out this week with a man out in Oregon who is working with young adults with psilocybin. So it is kind of,
That's the place to
it's
do it.
coming. Yeah. Yes. So how can someone reach you? And how could someone who's an audience member find out about your books and read more
My
about
books
what
are
you're
my
doing?
books are on Amazon, and shortly they'll be on the newest book I'm doing called The Revolutionary Ketamine. It's being published by Skyhorse, and that'll of course be on their website, my website, Amazon, and that'll hopefully come out soon. It's in the final editing stages. Um, and then I have just my website, JonathanEdwardsMD.com, with an H. You can find me there, and I'm contactable, uh,
Mm-hmm.
and I'm open to discussion, and yeah, just trying to help people, and yeah, it's gone well so far. I don't know where it's going to take me. It's an adventure.
Mm-hmm. Mm-hmm.
So
Well, thank you so much for being here today. And I'd love to keep in touch with
yeah,
you even
that's
after your
absolutely,
book comes out,
absolutely.
and any new data that comes along that you want to share. Because, like we said, we're in the beginning phases of this.
Yes, yeah, you know how to reach me, but thank you for
Yeah.
your this opportunity. It's always good to have these discussions, and and I enjoyed it
Yeah.
very much.